Okay. Um, so I'll get started here. Just to kind of introduce myself. My name's Holden Houston. I'm out of Springfield, Illinois. I work with a company called American Republic, which I specialize in Medicare, Medicare supplements, Medicare Advantage, prescription drug plans, short-term care, long-term care, all the health insurance that you can think of. Um, I have been selling insurance for going on 9 years now. So the number one question I get or comment is you're way too young to be talking about Medicare, which I am, but I am very knowledgeable when it comes to insurance and Medicare in general. So what I'll do today is first off, I'm not affiliated. Let me record this too. I'm not affiliated with the state of Illinois retiree plan. I do represent Aetna for Medicare Advantage and Medicare supplements and prescription drugs, but I'm not contracted with the Trail program. But I do a lot with state employees being here in Springfield, and my mom being one of them as well. I do a lot with the state plans. So I'm just going to start on this here. First, what I'm going to go through is just kind of a brief description of the 4 parts to Medicare to kind of educate you. The problem with Medicare, no matter if you're a state employee or just a regular employee, is they don't educate folks on how Medicare works. There's a lot of advertisement that goes out in the mail, the TV commercials, but no one truly takes the time to educate folks on how it works. When you go to look up a question regarding Medicare or Medicare Advantage, a lot of times you're going to get 10 sales websites before you actually get an actual answer. So I will get started. I'm just going to go through the 4 parts of Medicare. Okay. Part A is your hospital insurance. Okay. So on your physical Medicare card, it'll say Part A, hospital insurance. That helps pay for inpatient care at the hospital. It does cover some skilled nursing. It covers hospice very well. But the gist of Part A is your hospital insurance, your physical hospital bed. Okay. If you've worked over 10 years or 40 quarters, Part A is free. Okay. So for most folks, Part A is free. Part B is your medical insurance. That helps pay for your doctor visits, your outpatient hospital visits, x-rays, MRIs, medical services, durable medical equipment like walkers, wheelchairs, canes. And it does cover 21 days of home health care. Okay. So a good way to think about A and B is A is your physical hospital bed. Part B is anything outside of that, any in outpatient visits, doctor visits, things like that. Medicare Part C, that is your Medicare Advantage. Okay, so they kind of throw, where it gets confusing is they kind of throw this Part C in the middle of everything. Part C allows you to choose to receive all of your healthcare services through a private insurance organization. Okay, in order to have Medicare Advantage, you must have both parts A and B. Okay. And Medicare Part D is your prescription drug insurance. Okay. Part D helps pay for some of the cost of medication that your healthcare professionals prescribe. Okay. With the state plan, the Medicare Advantage plan, Medicare Advantage has prescription drug insurance built into it. Okay. Which I'll kind of have a better outline here to kind of show you. So there's 2 options when covering what A and B does not cover. Okay. Medicare Parts A and B roughly cover 80% of all hospital and doctor bills. Okay. Leaving you open-ended to 20%. That's where a person takes out either a supplement, a Medicare supplement, or they go onto a Medicare Advantage plan. Okay. Original Medicare on the left-hand side, you have your Part A and B. You take out a separate prescription drug plan, and then you take out a Medicare supplement plan. Okay. With original Medicare and a supplement, you pay a premium for that supplement, but you hardly ever see a hospital or doctor bill. Okay. On the other side, Medicare Advantage Part C, that combines all of your A benefits, your B benefits, your D benefits, prescription drug benefits, and it also includes a lot of times dental, vision, and hearing all in one insurance policy. Okay. The biggest difference between original Medicare and Medicare Advantage is on original Medicare parts A and B pay 80% of the bill. If you have a supplement, legally, they have to pay the other 20%. No questions asked. Okay. With original Medicare, there are already Medicare approved costs. So when you go to, say, Memorial Hospital and get an x-ray done, Medicare has already said that we'll pay X amount of dollars for this procedure, and the hospital agrees to receive that payment on original Medicare. Okay. On Medicare Advantage, you still have all of your A and B benefits, plus extra benefits, but it's issued and regulated through the private insurance company. So you're playing by their rules, whereas original Medicare, they pay X amount of dollars, and there's no network, no referrals, no prior authorization, anything like that. Okay. Going into the Aetna Medicare Advantage benefits. So I was doing some research, and my great aunt, she's on the state of Illinois. She was on United Healthcare last year, and now she's on Aetna. And I know a lot of folks were very happy with United Healthcare and how it worked and how it paid. Ironic enough, I was looking at the differences between the new Aetna plan and the United Healthcare plan from last year, and it's the same exact benefits, almost to a T. But I'll kind of go through these. Move my screen here. Okay, so there's an annual medical deductible on your Aetna plan for this year of $110. Okay, meaning that you basically pay out the first $110 before they pay anything. Okay, there's an annual maximum out of pocket. Okay, on the Aetna plan, it's $1,300. One thing I will note is a $1,300 max out of pocket is a very, very good benefit. What that means is the most that they can charge you for in-network services in 1 year is $1,300. Okay, granted, you do have a network with Medicare Advantage, and you do have to see certain providers. But as long as they accept the plan, the most that Aetna can charge you in copays, coinsurance, things like that is $1,300. A lot of these benefits are structured similar. Doctor visit, plan pays 85%. You pay 15% after the annual deductible. So basically how most of these benefits are going to work is you pay the first $110 out of your own pocket. Once that $110 is met, Aetna will pay 85% of the bill, and you will pay 15% of the bill for a maximum of $1,300. Preventative services, plan pays 100%, you pay 0%. Emergency, plan pays 100% after you pay the $120 copay per visit. That copay is waived if you are admitted within the first 24 hours. Inpatient hospital. Inpatient hospital, plan pays 85%, you pay 15% after the annual deductible. Outpatient surgery, plan pays 85%, you pay 15% after the annual deductible. Transportation, non-emergency. So this is something that original Medicare does not include. They will pay for 24 trips with unlimited miles allowed per trip. That would be to doctor visits and hospital stays, things like that. Lab works, plan pays 100%, you pay 0%. Diagnostic tests, x-rays, and radiology, the plan pays 85%, you pay 15% after the annual deductible. Home health care, plan pays 100%, you pay 0%. And then some other benefits like compression stockings, hearing instruments, and acupuncture. But for the gist of it, with Medicare Advantage in general, the premium is very low, but you will pay copays throughout the year. Okay. Because I offer Medicare Advantage along with Medicare supplements to everyday folks. The maximum out of pocket on a normal Medicare Advantage is about $4,600. So that's where that $1,300 is very nice to have. The biggest thing is, and I know a lot of people are upset with, is just finding a doctor that is in network. Okay. Prescription drug coverage. Okay. This is very similar to the United Healthcare as well. Okay. For the 2023 Aetna plan, there is a deductible of $125. Okay. Down where it says tier 1 generic brand. So any generic prescriptions, if you go to a preferred pharmacy, it's going to be a $9 refill. Standard pharmacy is going to be a $10. Muted on here. Okay. Tier 2, that would be preferred brand drugs. That would be a $30 copay for a 30-day supply. Tier 3 and tier 4, which would be non-preferred brand name drugs and specialty brand name drugs, would be a $60 copay. I offer a lot of different prescription drug plans and Medicare Advantage, and I will tell you that these copays that they're offering you is way lower, especially on the more expensive drugs. You pay a lot less on this plan than you would anywhere else. It might not seem like it at the time. The other nice thing is that you pay a copay all the way through the catastrophic coverage stage. Okay. A lot of people, if you talk to friends, that are on Medicare, they all talk about the donut hole. Okay. Which is the catastrophic phase. I'll go to the next slide here so you can see. During the donut hole, normally you're responsible for 25% of all retail costs. With the state of Illinois plan, you are exempt from that 25% coinsurance. Okay, so you just pay a copay all the way up until the catastrophic phase, which if you reach that phase, you just pay 5% of all retail drugs. So, for example, Eliquis is a pretty common, pretty expensive tier 3 drug. With the state of Illinois plan, when you get to the coverage gap, instead of paying 25% of that retail cost, which is about $250, you are going to pay the $30 or $60 copay. So the drug plan that is included on the Aetna state Medicare Advantage is unlike any other in that aspect. So basically you don't have a donut hole. Okay, so, and I know there's going to be a lot of questions, regarding the network and who you can see, because on this Aetna Medicare Advantage, and I had to educate myself as well, it's a PPO network with an extended service area. Okay, so from everything that I can read, they are saying that you don't have to go to an in-network provider. Okay, if you go to an in-network provider, there's no questions asked, they accept your insurance. If you go see an out-of-network provider, as long as they accept Aetna payment terms, they can technically take your insurance, and you can go to out-of-network providers and you'll be charged in-network prices. Okay, the problem with that is, and I tried to do research and see if I could find, different information on this extended service area, they have to accept Aetna's payment. So just a few points on this: can receive services from any provider that is eligible to receive Medicare payments to treat you. Your cost share will be the same as in-network care. Out-of-network providers are under no obligation to treat Aetna members except in emergency situations. So if it is an emergency, no matter where you are, a hospital has to take you, okay, whether they're in-network or not. If your doctor is not part of the Aetna Medicare PPO network, they may ask you to pay for services. If you decide to pay up front, you can submit a request for reimbursement to Aetna, which will reimburse you for the Medicare allowable rates for covered services minus your cost share. Okay. So if you go to an out-of-network provider and they say, hey, we're not network, they either have to call Aetna and talk about the payment details. If they say no, Aetna is saying that you can still go to that facility, pay for it up front, and Aetna will reimburse you. The thing about that is, I guarantee you're not going to get reimbursed what you paid. Okay. So you do have the option to go to out-of-network providers, even if they don't accept the insurance, but you're going to be out quite a bit of money if I had to guess. Okay. So costs for retiree and spouse. Okay. With the state plan, because there's 3 different types of departments that have different Medicare Advantage plans. With the state plan that you guys are on, it is a Medicare Advantage with prescription drug. It does come with some vision benefits through iMed. You do have access to the dental through Delta, and you do have optional life insurance. One thing to note when it comes to Medicare, Medicare Part A, if you've worked long enough, is free. Okay. Medicare Part B, in which this is new to a lot of folks that are first going on to Medicare from the state. Medicare Part B costs a premium no matter who you are. Okay. If you make, as a joint filer, the second column, if you make $194,000 or less, this year your Part B premium is $164.90. Okay. If you make more than $194,000 as a couple, from $194,000 to $246,000, you pay an additional surcharge. So your Part B premium would be $230.80 per month. And the more you make, the more you pay. So I kind of just want to throw that up there because I know a lot of state employees, they go from having health insurance provided to them at little to no cost, all your career. And then you get thrown into this Medicare thing where, yes, they're helping you out with the Medicare Advantage premiums, but you're still responsible for the Part B premiums that you didn't have before. Okay, this is just a chart of the cost for the Medicare Advantage depending on your years of service. If you've worked over 20 years, the cost is free. Okay. If you've worked under 20 years, they have lowered these premiums quite a bit. I think with the United Healthcare last year, if you had 0 years of service, it cost you $100 and some a month. Okay. So they did lower these amounts here. For a spouse, so this is a lot lower this year too, compared to last year. If you have a spouse where it says one dependent, that would be your spouse. Your spouse only pays $2.46 this year. Okay. Last year, a dependent or a spouse that wanted to be on like a United Healthcare plan, for instance, paid roughly $100 a month. Dental, I just put this on there just so you guys could have it. Delta Dental, $175 deductible. For a single member, it's $14. For a member and a spouse, it's $23 a month. That's pretty affordable. I sell a lot of different dental insurances. If you were to buy a dental insurance from me, it would be anywhere from $30 to $50 per month per person. So they are giving you a break on that. Life insurance. The reason I put this on here is because a lot of state employees that I help get enrolled into the Medicare Advantage are unaware of the life insurance options and the additional life insurance that you can take out. I put this on here from 65 to 69 for every $1,000 worth of coverage. It's $1.26 a month. Okay. So for $10,000 worth of coverage, for instance, would be $12.60 a month. 20,000 would be roughly $25 a month. The reason I tell everybody to take this out, if they're interested in additional life insurance, because this is very, very affordable. If you were to take out a $10,000 final expense policy from me, at 67, it would probably be $75 to $100 a month. So I encourage everybody to take out the additional. It's very, very affordable. They do have life insurance options for the spouse as well. Okay. Okay. Additional insurance to consider. I almost wish I didn't mute you guys, because now I'm just talking to myself this whole time. Additional insurance to consider. Okay. So the two things that you have to look out for or watch out for on Medicare Advantage is cancer. Okay. Cancer can be very costly, and skilled nursing. Okay. Cancer insurance, with you guys having a $1,300 max out of pocket, that's the most that as long as you're going in network, if you had to get chemo or radiation for the whole year, that's the most that they can charge you is $1,300. Okay. I can deal with that. Granted, if you need to go to Mayo's Clinic or MD Anderson or Cleveland Clinic and they're out of network, that cost would be on yourself. The biggest thing when it comes to cancer and the long lasting effects is the medication. Okay. The medication can be very, very costly over time. So I strongly recommend a small cancer policy for anybody, whether they're on Medicare Advantage or Medicare Supplement. So I just to give you guys an idea, it's pretty affordable. 65-year-old for a $10,000 cancer benefit is $32 a month. For a $20,000 cancer benefit, it's $64 a month. The nice thing about this cancer insurance too is it's cash directly to you. So say everything works out and Aetna pays for everything and you have a $20,000 benefit. Well, the cancer insurance isn't going to look how much you paid. They're going to cut you a check for $20,000 tax-free, and you can do whatever you want with it. A 70-year-old, $10,000, $37 a month, $20,000, $74 a month. A 75-year-old, $10,000 benefit, $38 a month, $20,000, $76 a month. Skilled nursing, okay. On Aetna Medicare Advantage, skilled nursing is roughly $200 a day. With you having a $1,300 max out of pocket, that helps. The biggest thing is finding a skilled nursing facility that's in network. Okay. I offer all kinds of different insurance. Like I said, there's two types of skilled nursing policies to take out. One is your traditional long-term care policy. Okay. These were very common and very popular in the past. At the age of 65 plus, if you haven't taken out long-term care, I'll just tell you, it's not a good idea. Okay. If they accept you, the premium is going to be outrageous. Okay. Long-term care pays for 3 to 5 years in a nursing home. What I would recommend if you don't have a long-term care policy is a short-term care policy. What that does is it gives you benefits for up to a year in a skilled nursing facility and gives you a home health care benefit for 52 weeks. Okay. So just to kind of show how that works is you can have up to a $400 daily benefit for skilled nursing, rehab, assisted living, nursing home, whatever it might be, for 360 days with a lifetime maximum equal to twice the number of covered days. The nice thing about these short-term care policies is there's a 0-day elimination period, meaning they go into effect day one. Okay. The other nice thing is your premium's locked in. So whatever age, whatever premium you take the policy out as, it will never increase from that day. There is a home health care rider as well. This is more common, especially after COVID. A lot of folks would rather get help at home than be locked up in a nursing home. This benefits up to $1,200 a week for up to 52 weeks. Okay, and that's cash directly to you. Because the one thing I will tell you, my great aunt that had the United Healthcare, she's currently in assisted living here in Springfield. She, with the United Healthcare, they covered home health care. Okay. The problem is when I had to deal with it, and I sell insurance, so I'm aware of what's going on. When I reached out to all the in-network providers, there was one in Springfield, and it was not a provider that I wanted my aunt to be taken care of. So even though there was a home health care benefit and it was technically 100% covered, we couldn't find a provider that was in network to use. Okay, home health care is very common nowadays, but it does add up fast. It's about $30 an hour with a minimum of a 3 hour stay per day. Okay. I just threw some premium examples up there just so you guys can kind of look at them on your own time, just to see if it's something that would fit your situation. A 65-year-old with a $300 per day benefit for 90 days in a skilled nursing facility with a $1,200 per week home health care benefit for 52 weeks is $123 a month. A 65-year-old with a $300 per day benefit for 180 days with a $1,200 per week home health care benefit for 52 weeks is $156 a month. And I put 70 years old premiums on here as well, just so you can take a look at. Okay. Here, I see a lot of people talking about leaving the state Medicare plan and going to a Medicare supplement plan. Okay. And I have quite a few state retirees that have done that. Okay. So there's a few differences between the two. Okay. On a Medicare supplement, you pay a premium. Okay. But you hardly ever have any copays. You might have a small deductible. There is no network. Okay, so as long as the hospital accepts original Medicare, which 97% of all hospitals in the United States do, they have to accept your Medicare supplement. There's no referrals necessary. There's no prior authorizations, and they're covered anywhere in the United States with a Medicare supplement. Okay, so you pay a premium and you have freedom to choose where you want to go, when you want to go, and who you want to see. On a Medicare Advantage, okay, especially in your guys' instance, you pay a very small or no premium. Okay, but it does have copays associated. Okay, so it's more of a pay as you go. The other big difference is there is a network, as you guys know. Okay, so they tell you who you can and can't see. And there are prior authorizations that are needed for some services, which can be a pain in the butt. They do include extra benefits like vision, hearing, fitness, dental, that Medicare supplements don't include. Here, I just did, for anybody that was curious of how much it would cost to go on the Medicare supplement route compared to the state plan, I just have a quick breakdown. Okay. For the state of Illinois Medicare Advantage right now, Part A is typically free, $0. Okay. Part B standard premium is $164.90. The Part C, which is the actual Medicare Advantage, is $0. And there's no Part D. Okay. Roughly comes out to about $165 per month per person. Okay. On the Medicare side of things, Part A is free, Part B, $164.90. Okay. Part C, I marked off because you don't have that on Medicare supplement. And Part D, which is prescription drugs, is $8.10 a month. Okay. Then you would add the Medicare supplement, which is roughly, give or take, $130 a month. Okay. That comes out to a little over $300 per month per person. Okay. So granted, on the Medicare Advantage, there are some things that you have to deal with that you wouldn't have to deal with on a supplement. If it was me, I would pay the $300 to not have to worry about anything. Right. But with the difference, you're almost paying half of what a supplement would cost being on the state plan. And it's not a bad plan. It'd be different if it was a bad plan, But with a $1,300 max out of pocket, you really can't beat that.